Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Hiatal hernia. Introduction. A hiatal hernia is a common problem. It happens when the upper part of the stomach bulges upward. A hiatal hernia may cause GERD. This stands for gastroesophageal reflux disease. GERD is when acid from the stomach leaks into the tube that connects the stomach to the mouth. This tube is called the esophagus. GERD is also commonly called heartburn. Treatments are available to treat GERD. Surgery may also be used to fix the hernia. This program talks about hiatal hernias. It explains symptoms and causes. It also covers diagnosis and treatment. The stomach and diaphragm. This section explains how food moves from the mouth to the stomach. It also talks about the role of the diaphragm. Knowing this will help you understand what a hiatal hernia is. After swallowing, food goes through a long tube. It is called the esophagus. This tube leads to the stomach. In the stomach, acids start breaking down food. This process is known as digestion. The acids are known as gastric juices. These juices are usually kept in the stomach. A valve mechanism keeps the acids in the stomach. It prevents them from going up to the esophagus. The valve mechanism is made of two muscles. These muscles help prevent the backflow of acids in the esophagus. This backflow is also called reflux. The first muscle is found in the area that separates the esophagus from the stomach. It is called the LES. LES stands for lower esophageal sphincter. This muscle allows food to go into the stomach but not back into the esophagus. The second muscle is the diaphragm. The diaphragm is a very large muscle. It separates the lungs from the abdomen. It also helps with breathing. The diaphragm has a hole in it. The esophagus goes through this hole into the abdomen. The hole is called the hiatus. It also helps prevent the backflow of juices from the stomach into the esophagus. If these two muscles do not work properly, gastric juices can go back into the esophagus. It can also cause heartburn. This is known as gastroesophageal reflux. It is also called GERD. The lining of the stomach is made up of cells that are used to acids. These cells are strong and are not damaged by acids. The esophageal lining is not used to acids. The cells in the esophagus are not able to tolerate these digestive acids. A hiatal hernia causes the upper part of the stomach to bulge upward. This means the point where the esophagus and the stomach are joined is above the level of the diaphragm. It is now in the chest. In these cases, the diaphragm does not help stop reflux. Symptoms. Sometimes a hiatal hernia does not cause any symptoms. This can happen if only a small part of the stomach is pushed upward. There may not be enough acid leaking to cause symptoms. Hiatal hernias that are large in size often cause symptoms of GERD. These can include back pain, bad breath, heartburn, problem swallowing. Some people with GERD caused by a hiatal hernia may also have a dry cough. This is caused by acid juices flowing back up the esophagus and down the lungs through the breathing tube. The breathing tube is also called the trachea. Coughing tries to get the juices out of the lungs. Symptoms are often worse when a person lies down. This lets more juices flow into the esophagus. In some cases, heartburn and back pain caused by GERD may feel like a heart attack. This is why it is important to seek medical advice if you have these symptoms.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. A hiatal hernia forms when part of the diaphragm becomes weak. The diaphragm is a large muscle. If it is weak around the hiatus, The top part of the stomach can bulge up. This results in a hernia. Doctors are not always sure why the muscles around the hiatus become weak. It may be due to an injury, pressure in the abdomen. The muscles around the hiatus may become injured or strained. This can happen from repeated coughing or vomiting. It can also be caused by straining during a bowel movement. This is more likely if a person is constipated. Pressure may be placed on the abdomen by lifting heavy objects. It can also be caused by pregnancy or giving birth in women. This pressure can cause a hernia. Some people are born with a large hiatus. The larger opening allows the upper part of the stomach to bulge upward. It is easier for these people to get a hernia. Hiatal hernias are also more common in adults age 50 or older, people who are overweight or obese, women. Diagnosis. Your healthcare provider will first ask about your symptoms. A physical exam will also be done. A hiatal hernia may be diagnosed using one of two tests. 1. A barium X-ray. 2. An endoscopy. For a barium X-ray, you must drink a chalky liquid. The liquid has barium in it. It coats the upper digestive tract. This includes the esophagus, stomach, and upper part of the small intestine. The liquid makes these areas show up on an X-ray. An endoscopy is a test that uses a thin, lighted tube to see inside the body. This tube is called an endoscope. First, the throat is numbed with an anesthetic spray. You may also be given medicine to help you relax. The tube is then passed through your mouth to the esophagus and stomach. Both of these tests can show if there is a problem with the esophagus or stomach. They can show if a hiatal hernia is causing your symptoms. They may also be able to show if there is another cause. Treatment. People who have a hiatal hernia may not need treatment. This is often the case if they do not have any symptoms. Treatment is available if you have symptoms. It may include lifestyle changes, medicines, surgery. Lifestyle changes may help some people control their symptoms. You should avoid alcohol, lose weight if you are overweight or obese, quit smoking.
Other lifestyle changes that can help are eating small meals more often throughout the day instead of large meals, eating at least 2 to 3 hours before going to bed, elevating the head of your bed about 6 inches, relaxing your mind and body before mealtime.
You can also avoid certain foods that can cause heartburn. Some examples of these foods are chocolate, citrus fruits, fatty and fried foods, garlic and onions, mint flavorings, spicy foods, tomato-based foods like spaghetti sauce and pizza, vinegar. If lifestyle changes do not help, other options are available. Many different types of medicine can treat symptoms of GERD. These include both over-the-counter and prescription medicines. One type of over-the-counter medicine is antacids. They neutralize stomach acid. This stops the acid from causing damage. These medicines work fast and get rid of heartburn.
Other medicines for GERD are also available over the counter. These medicines reduce the amount of acid made by the stomach. They are called H2 receptor blockers. Stronger types of these medicines are also available with a prescription.
Other medicines block acid from being made. They also heal the esophagus from any damage caused by GERD. These medicines are called proton pump inhibitors. Lansoprazole, Prevacid 24-hour, and omeprazole, Prilosec OTZ, are over-the-counter. Other types need a prescription. In severe cases, surgery may be needed. The goal of surgery is to fix the hernia. Surgery may include pulling the stomach down below the level of the diaphragm, making the hiatus smaller, rebuilding a weak esophageal sphincter. Often, surgery to fix a hiatal hernia is done at the same time as surgery to treat GERD. One type is called fundoplication. The goal is to make the area where the esophagus joins the stomach stronger. Part of the stomach is wrapped around this area. Other types of surgery may be done instead.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A hiatal hernia is a common problem. It happens when the upper part of the stomach bulges up through the hiatus. The hiatus is a hole in the diaphragm. The esophagus travels through this hole to connect to the stomach. A hiatal hernia can cause GERD. GERD is when acid from the stomach leaks into the esophagus. The acid may even travel up to the throat and get into the lungs. GERD may cause symptoms such as a dry cough, back pain, bad breath, heartburn, problems swallowing.
A hiatal hernia may be diagnosed using one of two tests. 1. A barium X-ray. 2. An endoscopy.
GERD is often treated with lifestyle changes. Medicines may also be used. Surgery can fix the hernia, but surgery is not needed most of the time. It is important to get treatment for a hiatal hernia that causes GERD. The esophagus can become damaged over time from the acids. Treatment can stop more damage from happening. It may also help heal damage that has already happened.
Thank you for using Explain.